Hi, my name is Andrea Bucalato, and I am the Program Manager of the Complementary Care Program at the Cancer Center. Welcome to Thriving Thursday. Thriving Thursdays are a series of events designed to promote awareness of health and wellness opportunities for those with cancer and other serious illness. Through partnership with Amy Devitt, Strategic Partnerships Manager of the Northeast region of the American Cancer Society, we are able to provide these programs. Our program today is on ConnectShareCare. The project manager leading ConnectShareCare is Beth O'Donnell. Beth has a master's degree in public health and has led a devoted project team to co-design and develop the ConnectShareCare platform. Beth is joined today by Janet Miller-Haynes and Andy Williams. Janet and Andy have been instrumental members of the ConnectShareCare design team. In addition, Janet and Andy are members of the live platform and currently support and assist care partners and bereaved care partners to find resources and peer support. We look forward to hearing about their experience. Let's hear from our panelists.
Hi, thank you everyone for the time. My name is Beth O'Donnell. For those of you joining locally, I grew up in Hanover, New Hampshire, and I'm currently joining from Grantham, New Hampshire. Janet Miller-Haynes, if she pops up and says hello, and Andy Williams, just to say, are dedicated team members, and we're going to co-present today. So thank you for this opportunity. I'm going to share my slides. So today I thought I would start off with just telling you kind of what we came. Again, thank you for this opportunity. I am a research project manager, as Andrea said, at the Dartmouth Institute for Health Policy and Clinical Practice. Usually we are located, we still are, but I'm been more remote in the pandemic on the 5th floor of the Williamson building at Dartmouth-Hitchcock, Lebanon. So today we're coming to talk to you about ConnectShareCare, which is an online peer-to-peer support network for care partners of serious illness. We want to provide an update to you, apologies, I want to provide an update to you on this network. And we want to give it in a different perspective. So I'm coming to you as a researcher, project manager, kind of a quality background, but I'm joined by my team members, Andy and Janet, who are both bereaved care partners and have the lived experience, and they've been on this journey from the start. I want to just generate some enthusiasm for what we're doing, maybe some ideas from you through discussion, and just some awareness about this. So that's what we're hoping to. We're hoping to present a little and then come to you. Just a sense, just a level set in terms of care partners. And so care partners, caregivers in some terms. This is our focus of our innovation. Oftentimes it's the families or people caring and providing support that are the hidden patients in serious illness. And so I think many of you are aware of the kind of local numbers in terms of what caregivers do and the burden they experience, and their need for emotional support and advice. And so what we have done is we're focusing on bringing people together, care partners who share a lived experience, so they can support one another on the journey of caregiving. Affirm experiences, provide information, words of encouragement. No problem with my view. So this is what we refer to as our problem statement. Care partners are often unprepared to manage or cope with the unexpected burden of caregiving and the circumstances that arrive with disease progression and in bereavement. This leads to not being prepared and not knowing what's coming up, has adverse effects on health and well-being, and leads to isolation and fear. And they're unsupported right now, I think, in our current healthcare system, and sometimes not seen or recognized. And so our objective is to help serious illness care partners. So it goes actually beyond cancer to heart disease and Parkinson's, and actually we're finding Alzheimer's disease. But to help serious illness care partners cope with the surprises that arise post-diagnosis and in bereavement. I'm going to transition now to a story to help kind of emphasize why we're focusing on care partners, serious illness. And I'm going to have Janet Miller-Haynes step in with kind of a story and her journey with this innovation.
Thank you, Beth. I'm from Glen Ridge, New Jersey, just to let you know that there are not all Flatlanders are here tonight. Words matter. There is a reason why you as a team decided on using the term Thriving Thursday. By the way, I love that term. But one of the things we are pushing as a team is the term care partner. When you think about it, the person with a serious illness is in fact in partnership with his or her caregiver. But it's not a one-way street. It is a partnership. When I was dressing Richard's toes that had been taken off, he let me know if the dressing was too tight. That we were in partnership, we were in communication, we were in feedback mode. So it's a partnership. And I would very much like you to be proponents of that new terminology. So that's a request. Originally, the design for this peer-to-peer tool took the individual, the care partner, from the diagnosis through the death of the individual, of the patient. We realized, however, that while the death of the individual is an end, it is also a beginning for the care partner who no longer has that role. And so it's been a goal of those of us that are in bereavement, have lost a loved one, to make sure that we lower expectations and have people understand that there's no such thing as a straight line. Let me give you an example. First of all, when you go on ConnectShareCare, you can get similar answers if you've gone on Google or Wikipedia. They will give you in 22 nanoseconds 72,312 answers, but not one of those answers uses a pronoun. They cannot say, I hear you. They will not tell you, this is what I did. They cannot say, try this. These are all responses that you're only going to get from an individual who has been where you are as an individual. Let me give you an example of a post that I shared that has gotten the most private and public response from the network. It was about 10 months after Richard had died, and I was absolutely convinced that I was well enough emotionally and mentally and spiritually and psychologically to go to New York and hear my granddaughter perform. She's a violist. And I did that. and we had a very nice time. Some other family members were there. And then I got on the bus to come home. And I literally wept for almost 5 hours. I was as surprised as anyone. I did not sob. I did not make noise. I didn't attract attention to myself, but I wept for almost 5 hours. I thought that I was along the grief process further than apparently I was. That was a surprise to me. And the dialogue that I've had with others has been very enlightening and reaffirming for myself, frankly, as they have experienced the same kinds of behavior, of emotional, wait a minute, what's going on? I thought I was in a different place. Being able to share one's experience has been a very affirming thing for me as an individual. And I know you're going to hear similar thoughts of satisfaction and gratitude for being able to be a part of this team from Andy Williams, whom you're going to hear from just a little bit later. Thank you for your time, and give us a try a little later. Thank you.
Thank you, Janet. And Janet refocused me like she always does. And so I took a breath and listened to her and remind myself why we're doing this journey. So I appreciate your words, Janet. I wanted to get to the aim statement. So this is like what we did was a proof of concept project, what we started. And this was an effort that was started actually in 2019. Our aim, so we with anything are focused in kind of quality improvement with aim statements and measurement, but also with design thinking and innovation. So we set out to design and build a customized online peer-to-peer support network for care partners of serious illness. And again, I should emphasize that care partners that are currently providing support or care to someone with a serious illness and those who've experienced a loss of a loved one. We aim to enroll, we aimed to at least get 30 to 50 care partners. And we wanted to focus on New Hampshire and Vermont. Again, we kind of worked in the development of this alongside our clinical teams and community kind of in the catchment area of Dartmouth-Hitchcock in Lebanon. And we wanted to test the feasibility and effectiveness of an online solution. So again, we applied human-centered design principles and quality improvement. And so really we got together, and it was clinicians and care partners, community liaisons, staff members, chaplains, patients, researchers, along with experts and advisors in health networks, such as Colleen Young from Mayo Clinic Connect, which is an online solution that has about 100,000 members and maybe 60 different groups online, different disease groups and focuses. Dave Gustafson, he's from Madison, Wisconsin, does lots of networks and research. And then this is a picture of Eugene Krasinski, who is local to us at the Thayer School of Engineering. And we designed it. We did little tests. How do we connect people? How do we share information? How do we affirm experiences? How do we get people to feel less isolated? How do we get information to people? And we came to the decision of doing it online, doing a solution online. And there's pluses and minuses, and actually there's a lot more pluses we're learning to being online in terms of access. especially when you're a care partner and you're unable to leave your house due to your caregiving duties, and the ability to be anonymous. So it has been a long, these are Post-its, and it's been a long journey. The two main functions, again, are a resource that can provide emotional support and an ability for peers, people with similar experience, to share information, real information. And then we came up with all these, this was our solution, and it must be this. It must be accessible at any time, especially for this population. And again, we also said there's benefits to being anonymous. You can be in a support group if you are able to. When we were face-to-face on a Tuesday at 4 o'clock, but you sit with 4 or 5 people and you can't be anonymous. Your story is out there. And you might not get a need met or connect with people. So accessible was important. Local was really important. That kept coming up. So there are online, one of the things that we did was we looked kind of at the literature, what's out there for online networks. Let's focus on also care partners and serious illness. Let's look at the features. Let's look at what makes them active. And we found some great ones, and we continue to, if it works, refer members. You might want to check this out or that out. But there was something to the local component. I want to talk to someone that drives 89 and goes to the cancer center in Lebanon. I want to know, I just want someone that's in Grantham. It needed to be secure. It needed to be moderated. The big thing, it needed to be, the group said, we need to own our data. I don't want people selling our data or trying to advertise things to me. I want it to be a safe space. We knocked off vendors that would build the community from the start. And we vetted. So here's where we are. So again, we vetted several vendors. We did several pitches to our leadership, both at Dartmouth-Hitchcock Health and the Cancer Center and the Dartmouth Institute. And we said we should do this. And we found a vendor and we did demos. And we built it. And what you're looking at now is the community. So again, it's an online solution, ConnectShareCare. This is kind of the landing page. The main thing is support groups, that's discussions, which I'll get to, resources, events. We started a feature that we also prioritize with stories. This is another way to get information. And then it's members, and you can private message the community, or there's public forums. This is again, because it's a private group, if you are a care partner or bereaved care partner, you can definitely join the community, and we welcome, but to protect anonymity, we're sharing here. But these are the types of discussions you can come on. Can you name your feeling? That has actually been a big one. And over on the right, my right, is the replies. So that, this is 414 replies. And the last one, I think this is old, but it was like 59 minutes ago. People are on here pretty regularly. There was a lot of pushback. An online solution, it's not going to work. People aren't going to come, and people are coming. We have a whole section on joys of hope. That was another thing that was prioritized. Let's not just ask questions and talk about the hard times. Let's show a poem. Let's show a picture of outside when the sun is out. You need to have nuggets of hope when you're on this journey of grief and loss. So it's an opportunity to really ask questions. I think this might be out of place. I'm going to skip this. So this is the resources. So again, at the heading, we have discussion groups where you can talk with peers, ask questions, share information. Then we have resources. We co-designed this with our team, Andy and others. We kept saying, what are the things that are coming to the top? We don't want to reinvent the wheels with resources. We just want to get to maybe the categories of needs that we keep seeing. And then can we work with our partners and our health system to say, okay, for planning ahead, what are the 5 things you always give to people? Okay, it's advanced care planning, advanced directive, and it's this. So then we prioritize that. So these are the sections: planning ahead, practical resources, emotional resources. And what it is you can click on these resources and it's paired with information, another opportunity to discuss. I love this book. I read it every day. You guys should read this, or, anything. It's a way to communicate on resources. And then again, at the bottom, we actually co-design, and we continue to do this within our health system. If you are a member coming and you are in the health system, Dartmouth-Hitchcock Health, we have tried to find kind of the programs and organizations within the health system that you should know about if you're supporting a patient. Chaplaincy, cancer center programming, elder life services. To date, we didn't find, we found the information in various places. So we co-designed this and we continue to build on it. We also have an events section, and I'm going to move on to Andy, but these are, again, some of the features: events, discussions, and resources. And I'm going to turn it over to Andy because this is one of our most popular, I want to say, features is storytelling. So Andy, I'll let you take it from here.
I just would like to, it's very nice to be part of this evening, as Janet said. I also live in the Upper Valley, and I want to highlight 2 parts of this. I think that Beth had the foresight to decide to add stories to the page, and she spent a time, more than a small amount of time, encouraging me to write a story about our journey, my wife's journey, and our experiences. We predated ConnectShareCare. And I need to tell you that were it to be around at the point at which we went through our journey, we would have been involved with it in a substantial way. Early on, Deb joined a listserv. She had a form of cancer, joined a listserv, and made connections, but they were hard to make and were spread out across the country. And though journeys were fairly similar, they weren't close by, and it wasn't, there weren't resources that we could make close use of. So we would have been much more involved had this been happening at the time at which we went through this particular experience. I want to take some time at the end to answer questions that some of you might have, but I think what is most important here is for me to understand, or me to explain to you, that Deb had never been sick before. We have 3 children. Other than the birth of those children, she'd never been involved, nor had I, with the medical community. We had no idea how to proceed through this journey. To find other people and to make those connections was profoundly important as we moved along. And though we had amazing care from the people at Hitchcock, from our palliative care doctor and from our oncologist, there were questions outside of that particular experience that I had, that Deb had, that our family members had. And to have a resource like this to be able to explore those questions and to learn, not necessarily from just clinical people, but from people who are on the same or similar path, was profoundly important for us. The complication was that we had to search those people out one person at a time, whereas ConnectShareCare gives an easy way for those connections to be made. The second part of it, which I want to touch on, is there are now, I believe, Beth, 4 stories on ConnectShareCare. And it's turned out, I think, to be a way, And I know that it's happened for me where people have read our story and then have online asked very specific questions, sometimes publicly, so that the whole family of participants on the website can read the questions. And in instances, they've asked very private messages about very specific things that happened to Deb or to me throughout the journey. The other part of this, which Janet alluded to and Beth has talked about, is though Deb passed away 3 years ago, and most of the story that I wrote about covered the journey, her actual medical journey, I didn't write in this story much about grief and grieving because I wasn't thinking about that as I was putting the story together. I had a participant on ConnectShareCare ask me what I learned since Deb's passing, which opened up another whole discussion and has brought a series of other people in looking at grief, grieving, bereavement, and what happens to all of us post, for me, almost a 6-year caregiving role. So without going into much more depth, I would encourage you to take a look at this. I would encourage you to read, if not my story, there are 3 additional stories or just other parts of ConnectShareCare. Thank you.
Thank you, Andy. And what you're seeing here, yeah, are just snippets of his beautiful story, thoughtful story, and his wife, Deb, at one of her most favorite spots, I think, in Canada. It's hard for me to not see everyone's faces. So if you're out there, I really appreciate that you're on this call and you're listening to us. And yeah, I'm grateful for it. So I just wanted to give you these are the progress. This is a kind of a busy slide here, and I'm going to be mindful of time because we do want to hear from all of you and if you have questions. We're watching, this is kind of a pilot, right? So we're watching some measurement, our main measures. And one of them is membership and registration. Can we get people to come and register? And this was all like, even though there are health networks out there, I mean, we literally, we built it and improved it and tweaked things and then let more people come on. So what you're looking at is over time, their number of registered members, it's by week is over on the left. So we are watching it kind of week by week. Some of these things that are grayed out are our efforts, right? We've been posting to local listservs, or we come and do a talk. Did that help us grow membership? While at the same time, we're trying to improve the platform and do small tests of change. The green line is the cumulative. And again, with anything, it's over time. I would say, you know, we really had our founding members, Andy and Janet, kind of in March and April, kind of get used to getting on and tweaking things. I would say we really didn't open it up maybe till May or July. And our clinical champions, we said, okay, start promoting this. Let's grow it. We feel confident. I think this is an old, and I think we're over 130. I'm not sure, it's around that range currently in terms of registered members. This is engagement. So again, we wanted to see, are people coming back? So that was the big thing, and why we wanted to constantly improve it is we could open it up and have a lot of people come, but if it wasn't good, or if there were lots of clinks with our system, nobody would come back. So what you're looking at is on the left is proportion of members. So October, November, December, January. So and these are a little out of date, but they're members accessing the website in the last 90 days. And again, I think it continues to be around 70% are coming back. They're coming back to the site. And so coming back is important. And then also growing new members is really important, especially for this population we're trying to serve. That and also I'll finally say that you don't always need to come back. Sometimes success is you come and you find out about paid caregivers in the Upper Valley and how do I figure this out, or I have one question, and you don't come back, and you come back when you have a need. Over on the right is the cumulative posts. So again, this is posts continue to grow as we grow the network and the diversity of posts. So again, I think down here it says a certain percentage, 40-something%. I apologize because of my Zoom. 43% of members have at least one post. And the majority in online communities, just based on the data and what's been out there, is actually a lot of people just come on and read. They call them lurkers. We don't love that term, but they come and read and they learn and they come back. This is referrals. So like anything, we are trying to get a sense of, where people are coming from. The big thing over here is we are trying to keep a close eye of Dartmouth-Hitchcock Health, clinical staff, clinicians and staff. We have champions that are promoting this. And I think for this continue to grow and live, we need to have a partnership with our local health system and have champions. So that's a really important metric for us. This is kind of the research or the evaluation component for people that are willing to speak to us. And it's really about understanding the feasibility and usability and utility of ConnectShareCare. We also want to understand the impact of the network on feelings of connection, connectiveness, access to information, and well-being. You're able to opt out, so you don't need to, you can still come on to the community and use it and not kind of agree to give us some feedback on how to make it better. We have plans to do, we're just kind of doing evaluation on 3 months. I think our 6 months surveys have already been distributed to those that have agreed to speak or to comment on their experience. And we're hearing good things. We're hearing people are satisfied. We're hearing it's easy to use. That was a big thing for an older population we know we would be serving. And we're excited by what we're learning. This is just some comments that I wanted to take a second for you all to read that we've heard from people that have used the community. And this gets to a little bit of what Andy and Janet were saying about it's really the meat of this community are the stories and the discussions. Connecting people that have walked in the same shoes, real people, feeling a part of a larger group, connecting with people. It's pretty powerful in terms of what people have responded in terms of this innovation and their experience. And at the same time, they're saying improvement ideas, which we're trying to also build on. This needs to be iterative. It needs to be constantly improving. It needs to be dynamic. I moderate the community and make connections and generate discussions, and my activity has been less and less. The community is doing it themselves. So again, just our assessment, it meets an unmet need locally. And we think that if we, this isn't rocket science, but if we support the families, especially more now than ever, have taken a big burden by not a lot's been put on them in the pandemic and not being able to be in our local health system. But we're going to help the patients. We're going to help the people diagnosed with the serious illness. We might have an impact on the relationship. The online solution, it's feasible. It actually, people are coming on and they're writing thoughtful posts. It demonstrates, like, what we're seeing is people are liking it. They're satisfied. And the big thing is they're saying they're able to connect with someone. And I think that is huge in terms of just feeling less isolated and getting real information that is actionable. And we set out to do 30 to 50, and we're at our health system kept saying, grow, keep going. And so that's what we're continuing to do, is grow. Again, our call to action is to come check us out, come see what we're all about. I'm going to butcher this quote, but when we were preparing for this talk, I think it was Janet said that you can't be an active or a passive patient. She can probably chime in. And you can't be a passive care partner. We need to activate these people. We need to activate them through connections with people like them, discussions, and get them better access to information and resources. And this is, again, we're in a larger collaborative called the Promise Partnership, and we have another event on Wednesday, I think it's May 11th. And if you're interested in hearing more about ConnectShareCare and other innovations, please come. And there will be an evaluation sent post this. And thank you for your time and support and for your attention.
Thank you so much, Beth. Now we have some time for questions and answers. Please post your questions in the Q&A section at the bottom of your screen. And while we're waiting for other questions to come in, I will read some of the questions we already have. So Beth, the first question is, how do I sign up for ConnectShareCare?
Great. I can actually, this is new forum to me, but there's a link. So we have a flyer, and you can go right to that. So, and it's pretty easy. I don't know if Andrea, if you can support me in getting that link out via chat or how we might distribute, but yes, you just have to click on the link.
Yes. And so in the evaluation we're sending, one of the questions will be, would you like more information? Please give us your contact information, and we will then chat with you over email and send you the link and help you get on. So the next question is, can I only participate for a certain amount of time? When I join, what am I committing to?
Yeah, good question. You're not committing to anything, I would say. When you join, you're coming, you can check it out. It's an online forum. You can use it how you want, based on your need. If you have a question, if you have a discussion topic, if you want to learn about events, and it wanes. People come on and they're talking a lot when they have a minute to look up and they took a walk and they're on a lot. And then they might say, I'm going to go quiet for a little bit. Things are crazy. So it's really based on life. It's supposed to be accessible to you. That's part of the, we think, the good thing about an online solution.
Great. So again, audience, if you have any questions, please free to write them in the Q&A section. And in the meantime, I'll continue with the questions that have come to me. How do I, or can I share this information with friends who don't live in New Hampshire or Vermont? Can people outside our geographical area participate in ConnectShareCare? Yes,
definitely. The answer is yes. we designed this, we were worked with palliative care and the cancer center at Dartmouth-Hitchcock in Lebanon. And we definitely knew that the need was large in our area and that we wanted to do something for Vermont and New Hampshire. And so the only thing that you'll see is that some of the resources are Vermont and New Hampshire focused, but the discussion isn't. And we actually have, I know, several members that are across the United States. So.
Thank you. And the next question appears to be for both Andy and Janet. How did each of you become involved in this project?
Just because I love this question, I will be the first to answer, and Andy, I will turn it over to you eventually. My husband died at the Jack Byrne Center for Palliative and for Hospice and Palliative Care. And it was such an extraordinary experience for me and his children and their spouses and our grandchildren. We were able to be with him for his last days and saw a person at rest, peaceful, no stress, no pain, no anxiety. And we were with him at his last breath. That was an experience that I needed desperately to say thank you for. And so I reached out to the then executive director, Ruth Thompson, and said, how can I need to give back. I need to say thank you. I need to do something. And she actually is the one that got in touch with the peer-to-peer support network team that was in the process of forming. And as a newly bereaved widow, I became kind of a proponent or a representative, if you will, of those that have lost that patient and now must move on. And so that's how I wound up involved, and I have not regretted one single second of it. Thank you. Annie, take it away.
Thank you, Janet. That's beautiful.
My journey is actually fairly similar, probably not surprisingly. Shortly after, about 6 months after Deb died, I reached out to our palliative care doctor and asked if there were ways in which I could pay back a little, just to put it in a quick way, because of how profoundly helpful both our oncologist and our palliative care doctor had been. I became a palliative care volunteer at that point and started on a regular basis and spent about 6 months doing that until, unfortunately, COVID arrived and that disappeared. But my involvement there with palliative care, I believe behind the scenes, made a connection for me with Beth's project. And Beth was looking for people who had had practical experience, and she reached out to me and said, would I be willing to give a hand? And as Janet just said to you, I think there are many of us in this institution as volunteers that want to try to lend a hand, because we're so indebted to the quality care that we each received.
Amen.
Thank you both. Thank you both for your hard work on this project and your wonderful stories. We have
go.
Excuse me. Go ahead, Beth.
Just one more comment that they won't tell you is that both Janet and Andy are volunteers at the hospital. I work with the palliative care team, but they've also gone on through this project. Andy is now supporting another effort He sits as a family representative at the Cancer Center to spread serious illness conversation training across the Cancer Center. He is now, again, in addition to that, he now sits on the Palliative Care Bereavement Steering Committee, which meets monthly. And Janet now, we connected her to Project Echo, I think on end of life and quick educational sessions. I don't know if you're familiar with that for clinicians and community. So it's pretty amazing in terms of their journey and how they're contributing now within the health system. Thank you.
Thank you so much for sharing that. We have a question from one of our nurse practitioners. As a provider, how do I get this information out? Beth, do you want to take that? Or do you want me to?
Oh yeah, you could take it first, sure.
Okay, so I'll start and then Beth can add. We have information about ConnectShareCare in the complimentary care program guide that we make available to patients. We also have postcards of ConnectShareCare available in our office. There are also slides throughout Dartmouth-Hitchcock in the different monitors in waiting rooms. But we strongly encourage providers to let caregivers know, care partners know that this is available. And for further information, they can contact me, Andrea Bucalato, or Beth O'Donnell.
Yeah, thank you. You know, what I'll add to that is I want your name and I want to talk to you too. But we've been working closely with clinical champions in palliative care and the Cancer Center, and we kind of have a handful. And so the next kind of effort is we do want to look at kind of referrals and how to make it easy for getting the news out. And so so that we can scale it. And so Andrea mentioned kind of, yeah, where it's marketed and how to get there. But we are going to look closely about how to make it really easy during a clinical kind of interaction where you can connect people to the resource. And I just want to make sure that I know to embarrass Andrea, I don't know if it's appropriate, but she has been a dedicated team member for this innovation and leader since the start. And she's been incredible. And what she does for the Cancer Center and her energy and her knowledge is profound. And so we are here. This is our team. We're representing a much larger team, but I wanted to make sure I noted that. Thank you.
Thank you, Beth. And the nurse practitioner is Elizabeth McGrath, and I will be happy to send you her email. Okay, are there any more questions from the audience?
Andrea, if you wanted me to stop sharing and I could even put in the link or share a flyer for ConnectShareCare, I can do that.
That would be great. That would be a great closing slide.
Yeah. Let me just type it in if that's the best thing. I'm going to get the flyer for you. And what if there's any other questions?
So I don't see any other questions coming in. Oh, here's one. The person says, I participate in a care partner support group currently. Can I also participate in ConnectShareCare?
Yes, I'm just looking for this marketing. And maybe you can take that question first,
Sure.
Andrea, and you can answer it. I'll look for our flyer, but yes, yes, yes.
Yes, and actually, as the facilitator of the Cancer Center's Care Partner Support Group, it's part of every meeting that we talk about. Please know about ConnectShareCare. This is an additional resource for you. And many members of our Care Partners group are also on ConnectShareCare, which is a wonderful transition between both programs and both ways of support. So great, here we have the flyer.
I apologize. Is that okay for viewing?
Yeah, yeah.
ConnectShareCare.org. You can go right to it. What I will add to that comment is that response is when we were doing the design of this, and we came together with insights, right? That's what they call them in human-centered design or design thinking, insights, local matters, and peer information is authentic. We also said that it would be ideally to have an online solution with opportunities to meet face-to-face, with supplements of face-to-face opportunities. With COVID, it's been challenging to do that, but I would hope we plan to have more opportunities where we can meet face-to-face. And what I think about, if you're in a group and you have connections, I actually think that this is a great supplement to connect with your group and community between your meetings or your programming. Some of the sessions that we found are 6 weeks and then they end for bereavement support. ConnectShareCare doesn't end. And sometimes just kind of seeing someone personally, or even being on Zoom, it makes it easier to interact online. So thank you.
Thank you. That's a wonderful, and more questions come in. Let's see what we have here. Is there a connection between Southern Vermont Medical Center and ConnectShareCare? Thank you very much for that question. I happen to know the social worker from the Southern Vermont Medical Center, and I will be sure to share this information with her, because she may not know we haven't advertised there. So that is a fantastic question and reminder to me that they're part of our network, and we want to make sure they know about it. So thank you very much. Okay, oh my goodness, here we have another question. Let's see. Is this for cancer folks only? No, this program is for care partners of those with serious illness. So it is not just cancer. And as we said earlier, there are care partners who are caring for someone with Alzheimer's. So thank you for asking. And when we send out the evaluation, if you want us to connect with you individually to help you get on this site, we are happy to do so.
One thing I'll add to that, Andrea, to the yeah, it is for serious illness. We have a definition which is pretty broad in terms of who falls in that category. And it's even, we're finding people that support the caregiver. How do you support the person that's, driving everywhere and managing everything? And so I actually think this could meet needs of a large community. And we co-designed even the profile. So you can get on and you can make a bio, which is a few sentences, and then we actually co-design the questions. Are you someone that is actively caregiving or experiencing loss? What is the disease that you're caring for? What's the relationship? We know that matters. Is it a spouse? Are you caring for a parent? And then there's some other questions. And the reason we did that was so that you could find someone more like you if you wanted to. And we know through private messages, people have said, I'm connected with this person. I'm going to send them a chat. And as the community grows, we do see that there might be a group in terms of, it might be cancer or Parkinson's, but we're letting it evolve.
Okay, another question. Does this operate like a blog?
To be transparent, I'm not totally clear on blog, but it's asynchronous. Is that the word? So it's, again, it's, I actually was on, I'm the moderator, and go on, and I'm on last night, and I'm posing a question. 3 people wrote back to me in 2 minutes. People are on, and I'll call people out and say, it's a sunny day. What did you guys go out and do? 2 minutes later, I was just skiing here and I just saw a beautiful picture. People are on, and it's posing questions and conversations, and the same thing with the resources. It's saying, here's a resource, and kind of conversations, and saying exactly like, is it John LeMay? And do you know about this medical center? You should be here. And literally we try to improve it while we hear from people. So thank you.
We have time for just one more question, if anyone would like to post one. Okay, we have a question. In other words, do we receive emails is the question.
Oh, so you can opt out of emails. The one thing that we created actually to help navigating ConnectShareCare, because they're actually, as it grows, there's more conversation. We have something called a daily digest, which, or you could get it weekly, or you could get it not at all. But it comes in the morning and it says like, this is, there's been 30 contributions since yesterday. And someone asked a question about this, and someone asked a question about this. And then you can go into the online community. So again, it's online, you have a password. I believe once you kind of get there, your browser should remember it, and it should be relatively easy. But you don't necessarily get emails. It's all in the community, if that answers your question. And Carol, I would love, to see you. I'm reading your story.
So thank everybody who participated with us tonight. Thanks especially to our panelists, Beth, Andy, and Janet. Please respond to our evaluation. We really do want to hear from you. And our next Thriving Thursday series will be in June, when we actually will have 3 in a row on different topics related to survivorship. So once again, thank you for joining us, and we hope to see you at future events.